So I'll be speaking on femtosecond laser assisted keratoplasty. So it's well-known equipment that we use in daily practice and known as weapons of ophthalmologists. So it won't be wrong if we call them old weapon of ophthalmologists, as femtosecond has taken over or all these instruments in our practice. So femtosecond lasers are doing everything from cataract to LASIK to keratoplasties. And femtosecond laser is a photodisruptive infrared laser with a power of 10 to the power minus 15. So why we switch over to femtosecond keratoplasty? Whereas manual keratoplasty is a time-tested, most successful organ transplant, although it has some surgical challenges like problem of trephination, problem of ledge, the suturing technique, what is the correct technique, what is the correct tension of sutures, high astigmatism post-operatively, higher endothelial cell loss because of the handling the tissue, and slow visual rehabilitation. So to overcome all these situations, now we have femtosecond laser, which has the ability to perform incision of any angle at various depth within the corneal tissue. It permits full thickness graft with peripheral lamellar wound configuration. It works with a greater precision, finite control, and in an automated manner. It does minimal donor tissue manipulation and less endothelial cell loss. The main advantage of femtosecond laser is that in manual PK, the wound configuration is always vertical, whereas in femtosecond laser, you can create any type of edge like top hat, mushroom, zigzag, and any other configuration is possible. Because of this multiplanar configuration, the healing surface area is more, so the healing is faster in femtosecond laser assisted keratoplasty. So what kind of incision is best for which surgeries? For example, if it's a case of pseudofocal bullous keratopathy, top head shape is better because it removes less stromal tissue and more abnormal endothelial tissue, whereas mushroom shape is better because it removes more abnormal stromal tissue and saves more endothelial tissues, like in keratoconus cases. So there are studies that have compared the results of femtosecond laser versus manual keratoplasty, and they found that femtosecond is always better in terms of endothelial cell loss, less astigmatism, and faster recovery. So there are various platforms that gives the option of doing femtosecond laser keratoplasty, and right now we are using Femto-Z8 from 𝐁𝐨𝐸. So this is one of the case done by femtosecond laser. You can see this is a case of dense corneal scar. So with the newer platform, you can penetrate the dense scars also. So after planating, the dissection is done, and this is the donor cut by femtosecond laser after removing the epithelium. The docking is done, and most of the time the cuts are very smooth, and with the intraoperative feature you can adjust your cut area, and just you have to peel the tissue. And the lens was implanted after removing the cataract, and the graft was placed. You can see the configuration, it just fit in the donor and the host. This is in the case of keratoconus. So advantage of femtosecond laser is that you have to put less sutures most of the time. 12 sutures are enough for all the cases done by femtosecond laser surgery. See, the position is very nice on the table only, and there is no overriding or underriding of the graft. So this is a OCT imaging showing the host and donor position. It's very nicely seen here. So laminar keratoplasty is already covered by sir, and this is another case of recalcitrant epithelial ingrowth where we have done multiple time scrapings and all those maneuvers, and ultimately we have to do ALK for this case. So in such cases, OCT helps very well because you know the depth of the disease and proceed accordingly. So you can see this area, and the cut is done and surgery. So going to the next slide, and this is a post-operative picture of the same patient. You can see the donor and the host is nicely opposing each other without any interface scarring. This is another interesting case of central corneal disc scar where I performed hemi-automated lamellar keratoplasty. Because femtosecond doesn't penetrate with this scar, so what we did, we create a mushroom shape cut, donut shape, and we get a plane all around the scar. So this is a femtosecond plane. So now this scar will be dissected by manually, but with the help of this plane, the whole opacity is dissected in a single plane. So there is no chance of uneven surface post-operatively. And this is a donor dissection, and suturing is done. So this case also did well in post-operative period. So this is the last video that I'm showing. This is a femtosecond DAL. As Dr. Rishi told that it doesn't help too much in DAL cases, but with the new platform, we have the feature of creating a tunnel. So after the stromal dissection, you can create a tunnel, so you are sure your bubble will end up and you will get a big bubble in almost all cases. So that is the advantage of this machine. So this is a case. So after removing the anterior stroma, this is a tunnel created by the femtosecond laser, and you have to enter in this tunnel. And you can position the tunnel sizing, depth, and all those things, and then you have to enter with the formula cannula and just inject air.
Sir, I'm really sorry, sir. We are actually running out of time.
We have run out of time. Not running.
We have run out of time.
Thank you.
Thanks
Thank
a
you
lot,
for
sir. Thanks a lot.
patiently